Hello and welcome back to the Center for Sexual Health and Education. Today we're going to talk about skin care of the vulva. The vulva, the vagina, the general area down below in women. It's surprising to me how many women never learn the basics of skin care for their area. Remember, much of this is taught by your mother when you're a small girl, so if she wasn't trained correctly, the bad ideas are perpetuated throughout the generations. So let's go over some of the basics. The area is called the vulva and the vagina, and it should be cleaned with soap and water. It appears that liquid body soaps tend to be more irritating than bar soaps, so if you're having problems with irritation, switch to a bar soap like Dove or Dial, something bland for that area. Simple ideas like wiping. When a woman wipes, she should always wipe from front to back. It is surprising how many women of all ages do that incorrectly. Several pull forward. When you're doing so, bacteria from the back can get into the front accidentally and set up annoying discharges. So always remember front to back regardless of what's going on. Some of the other irritants that are commonly reported. Remember that women often come in claiming that they've had a yeast infection and the over-the-counter medications aren't working. Well, very often yeast is not the problem. Some of the common things that irritate women. Number one, baby wipes, feminine hygiene wipes, cottonelle wipes. Although they're used and are marketed as a healthy product for down below, in many women it causes a tremendous amount of irritation. So please avoid those. We talked about liquid body soaps. Bar soaps are probably better for those women who are having symptoms. Thong underwear. They look great, but they tend to cause irritation when used for prolonged periods of time. So perhaps pick your favorite thong for your evening out, and perhaps even choose commando or no panties to give the area some air. Powders, lotions, sprays. I know there are a myriad of over-the-counter products that promote themselves to freshen the area. The area is not supposed to smell like flowers. So putting a flowery spray down there is not going to do anything for the problem you're having. If there is an odor down there, that's a bacterial infection. It needs to be treated with antibiotics. Douching is generally not recommended. However, if you have a hot date and you've just finished your period, perhaps that would be acceptable from time to time. But otherwise, douching is not meant to cleanse the area. In fact, it removes all of the good bacteria in the area, and although it may smell better for a day or two, it generally comes back with a more pungent odor after that. So avoid douching at all costs if possible. One other habit that women do is wear chronic use of panty liners and pads to feel fresh on a daily basis. In fact, those pads and panty liners trap moisture and may actually make it less fresh down there. So other than during the menstrual time, try and avoid the use of pads and panty liners. Now, we'll get into the topic of leaking in another discussion, in which case I understand that those pads are required, but for general freshness due to discharge, my recommendation would be to change your panties as opposed to wearing pads and panty liners all the time. Let's briefly talk about normal discharge. Normal discharge. After your period ends, the discharge should be very stretchy and snotty and mucousy and abundant. And this is caused by estrogen. It's a good sign, and that lasts for about 10 days to 2 weeks. And then the discharge becomes sort of white and milky, and this is the beginning of the effect of progesterone on the vaginal mucus, cervical mucus, and it becomes more of a white, milky look. And then finally, just before the period, the discharge dries up and is sort of a white, chunky discharge for about 3 to 4 days prior to your menses. So these are the phases of normal discharge across the cycle for all women, and it varies based on how healthy you are, how excited you are that month, and certainly where you are in your age as far as menopause. So hopefully that gives you some general ideas on vulvar care and what normal discharge is. If we can answer any more questions for you, contact us at bestsexualadvice.com or the Center for Sexual Health and Education. Thanks and have a nice day.